Hi guys. Today's listener submitted question was, does my cat get depressed when I leave for work and I have long days out and about? So great question. Get this question a decent amount, so thank you for submitting it. So everybody has their own opinions. Depends who you talk to. Veterinary field has developed behavior specialists. They might have a little more insight on this as well, but I'll give you my opinion because that's what you're here for. So, in my opinion, in my experience, yes, I do think some pets do go through a depression and a behavior thing. Where do I see it the most prominent and kind of the easiest way to see it? It's a little bit of a sad topic, but generally when a loved one passes away. Now, that can be a housemate passes away, or that can be an actual owner that passes away, or unfortunately, in some cases, the kid, and that's who their fur baby was, and so on. Other times that I come across this a decent amount is right after high school graduations, when the high school kids are excited, they graduated, they had their summer break, everything's been normal for the last 17, 18 years, and now they're leaving town to go to college. That is another time where I will have the parents bring the pet in and be like, oh yeah, that's what's changed. It's one of the questions that we'll ask. Has there been any lifestyle changes, construction in the house, family members leaving, anything? Most of the time, clients will volunteer some of this because they'll be a little suspicious. So a lot of times that helps guide that conversation. I do think every patient is different. Some patients really see no change at all in their activity and depression. Others, a day, a week, occasionally a few months. Once again, every doctor is different about it. Generally, if there was something dramatic like the passing of a loved one, I will give them a couple of months, anywhere between 1 to 3 months, to kind of adjust and figure out the new routine and how new things are going, maybe bond with a new person, whatever it may be. In my opinion, once we're getting past that 90 days, that's where I think some of the medical intervention needs to come into play, and there's a cocktail of a lot of different things. Every veterinarian has their own cocktail that they prefer. Nothing works consistently for every patient, or that would be the one sole drug that we would go to every time. But the good news is we got a lot of mixing and matching and things. This one may work great for this patient and not for this one, and vice versa. So the advantage with that is it gives us a lot of options and a lot of hope in a lot of things that we can do to help with it. So that's kind of the gist of it. On the lower end scale of this, there's some little things and new programs at home where you can do environmental enrichment. I like frozen peanut butter in a Kong. Just be careful, make sure they don't get too fat. And you can turn on doggy music. You can turn little scents and smells that are around. There's even doggy or cat TV now. I think a lot of them you can pull up on the internet through YouTube and things like that. So those are little things you can try and do. Sometimes just having another litter mate in the area helps. Occasionally they don't get along either, so tomato, tomato. So thank you again for the question, guys. Thank you for all your help, and we'll see you next time.